Hello everyone. Today we are going to be discussing a question from typicalpt's platform. Let's jump right in. Alright, here's the question. A 40-year-old female presents with a complaint of chronic low back and right hip pain. She reports a deep, achy pain localized mainly around her right sacroiliac, or SI, and hip joint, which intensifies with prolonged standing and sitting. Which of the following tests is the most sensitive and could be used to rule in a hip joint issue? Let's go through the answer choices. A. Scour hip test. B. Genslen test. C. Patrick's test. D. Ober's test. Go ahead and pause the video right now. Think through the logic and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice C, Patrick's test. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from typicalpt. You can find this diagram and other helpful resources inside that book. Now, let's explain why Patrick's test is the correct answer. Patrick's test, also known as the Faber test, is used to assess hip and SI pathologies, particularly involving the anterior labrum. According to the diagram, this test is considered highly sensitive and is specifically highlighted as being useful to rule in hip pathology. A positive finding depends on the location of pain. Anterior pain suggests labral or capsular dysfunction, while posterior pain points toward SI joint dysfunction. Because this question asks for the most sensitive test to rule in a hip joint issue, Patrick's test is the best choice. Now, let's take a closer look at the diagram shown. The table compares several special tests used for hip and pelvic assessment. The scour or grind test is shown as being used for labral tears and degenerative joint disease, with positive findings of pain, crepitus, or clicking. Faber's or Patrick's test is listed as assessing both hip and SI pathologies, with pain location helping differentiate the source. There's also a clear, quick tip in the diagram emphasizing that Faber's test is a highly sensitive test used to rule in hip pathology, which directly supports the correct answer. Finally, Fader's test is shown as assessing anterior superior impingement or anterior labral tears, with pain or clicking as positive findings. Now, let's explain why the other answer choices are incorrect. Choice A, Scour hip test, is incorrect because although it is used to assess hip joint pathology, it has a sensitivity of around 62%. While reasonably sensitive, it is not as sensitive as Patrick's test, making it less effective for ruling in hip joint issues in this scenario. Choice B, Genslen test, is incorrect because it is specific for SI joint dysfunction, not hip joint pathology. The rationale notes that it has a low sensitivity of about 37%, meaning it is less effective at identifying true positives. Additionally, this test is more appropriate for ruling in SI joint issues rather than hip joint problems. Choice D, Ober's test, is not the best choice because it is primarily used to assess tightness of the iliotibial band and tensor fascia lata. It is not specifically focused on evaluating either the hip joint or the SI joint, making it less relevant for ruling in a hip joint issue. Now that you've completed this case, take a moment to record the key points in your typicalpt digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing musculoskeletal-related conditions. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at typicalpt for daily study tips, quick reviews, and motivation to keep you going.